My journey to become the Chief Medical Officer of CNSdose started out by being a medical doctor focused in psychiatric care. So I was seeing patients day in and day out, and I really enjoyed that. But the process of trial and error prescribing of medications was very frustrating and demoralizing for me, and I knew that we could do it better. The CNSdose started from doctors, scientists, and executives recognizing that the way that depression is treated with antidepressants is trial and error, and it's really not good enough. So we had a very precise, unmet need in the mental health treatment sector, and we've built a tool to transform that process to go from trial and error to more personalized and precise. The product of Amplis is very simple. So what we do with a simple cheek swab is we look at the patient's liver and brain genetics, and we can provide a personalised and precise approach to the treatment of depression with antidepressant medications.
And a big part of engaging that individual is creating what I call a golden moment in medicine. And that golden moment occurs when you feel like you're treated very personally, and that I understand you, and I empathize with what it's like to be dealing with what you're doing. And what I'm going to do for you is going to be unique.
With our product one, genetic guidance of antidepressant medications, we did a soft launch with that technology in the US. And what that taught us is that doctors really liked our tool, psychiatrists really liked it, and primary care doctors really liked it. And so they requested for us to expand our offering from not just antidepressants, but to all mental health medicines and chronic disease medicines.
When we talk about precision mental health, what we're hoping to do is bring to bear the emerging, novel, and proven technologies that are being developed and that are available, and bring them to bear to benefit an individual, and to equip clinicians with better tools to be more discerning in the diagnosis, to identify a customized treatment plan.
We found out about the Melbourne Accelerator Program through word of mouth. Being at the Melbourne Accelerator, being surrounded by wildly different types of companies, it really shook me out of my medical scientific thinking and made me realize that the world of creativity and entrepreneurship was extremely broad, and that I was really just at the beginning. I had a lot of good experience as a doctor and a scientist, but that I had a lot to learn, and I had a lot to think about how can we cross-pollinate creative ideas from different industries that are completely non-health related into the health system. We achieved a number of milestones going through the Melbourne Accelerator Program. We optimized our business plan, we attracted high-level advisors, we entered the US market, and we raised $1 million of investment capital. For us, going to the Texas Medical Center made sense because it's a hub for high-quality health innovation in America. It's very well known. It's the biggest medical center in the world. As an Australian company, we're very proud to be able to come back to the Australian market and to have a major presence in Melbourne.